Hi, welcome back to my channel. So today I want to talk to you about what makes a great medical director. So say you're a nurse or you are just getting into the med spa space. I want to tell you, when you find your medical director, these are the 3 things you should definitely look for. So number 1 is going to be experience. You can find a medical director with not that much experience in the field you're going into. There's a lot of med spas where their medical director is a neurosurgeon or a vascular surgeon or a primary care doctor that doesn't know anything about aesthetics. But what you will find, and this has happened to me several times, is that I've had a lot of spa owners, they work with other doctors who maybe were a little bit more affordable, they didn't have a lot of aesthetic experience, and they wasted a lot of time trying to explain to them how to sign the chart, what to look for a vascular occlusion, or how to hire an aesthetic nurse, what to look for. So basically the number 1 thing you're gonna save when you hire someone that has experience is your time and therefore money. So when you hire someone who's experienced, we already know how your corporation is supposed to be structured, how an MSA would be structured, and how you would contract with a medical director. We know that you're supposed to review at least 20% of charts. We know what the scope is for each person or staff in your practice, the esthetician, the RN, the NP. We already know also clinically how to manage adverse reactions, but the clinical experience is probably secondary to the business and the actual medical directing experience, because there's just so much business and sort of business structure that you are going to spend doing your very first year of building your business, that having someone on your team that's already been through it is going to save you so much time and so much stress. Also, they're going to save you from making mistakes, and mistakes that could be potentially cost you money, more taxes, and legally get you in trouble. So you want to make sure you start with a team, a lawyer, a good CPA, a medical director that are going to get you set up exactly how you need to be set up from the very beginning, so you can just hit the ground running. The second thing is actually clinical experience. So a lot of medical directors, they've never injected Botox, they've never injected filler, or they've never managed an adverse reaction like an occlusion or an inflammatory nodule. And so when you are starting your business, and I went through this when I first started my business, even though I was already done with residency, I had so much experience doing advanced procedures, I didn't know how to manage someone who had a ptosis, like I dropped their eyelid, and I couldn't sleep for a week, and I had no one to call. And so basically the first 2 years of managing my business, I was managing the business side and it was managing the patient care side, and it was really stressful. So if you can imagine going through the first few years of your business and having someone to call and ask them, hey, this happened, how do I talk the patient through it? Or hey, is this an actual medical emergency? Do I need to do something, or can I see this patient on Monday? So having that experience and someone in your corner is invaluable, especially the first few years. So number 3, you want a medical director who's really invested in you, because it's not just about the money. It's actually about being with someone who can help you through entrepreneurship. It's a very lonely and isolating experience. And so working with a medical director who has other spas or other business owners or has gone through similar things is able to really foster a relationship with you, and you can call them, or you can even talk to them when you're feeling excited and you want to share in a business win. I will say my partner and I are both entrepreneurs, and so we share so much in building our business, but there's just something about going to lunch with a fellow business owner in aesthetics who just gets it, or they understand what a difficult patient experience is like. So there's just something about having someone that exactly understands what your industry is and what you're going through, and who wants to be with you as your business grows. So wants to be with you in the year 1 and 2 that you're building, but also wants to see you grow and thrive into year 5 and year 10. So go ahead and check out my other videos about how to be a good business owner.